silent, invisible, lethal. These three words embody one of the most serious threats to human health: blocked arteries. The frightening truth? You might have them right now without even realizing it. Each minute, somewhere in the world, someone suffers a heart attack or stroke because their arteries have become so clogged and narrowed that critical blood flow is interrupted. This impacts their heart, brain, legs, cutting their life short in an instant. As a physician, I frequently encounter this scenario. A man or woman visits me with seemingly minor complaints: a bit of chest tightness, slight shortness of breath, fatigue, dizziness. They often attribute it to stress or age, yet beneath the surface, something far more dangerous has been developing for years, sometimes even decades. Arteries thickening with plaque, blood flow stalling, organs deprived of oxygen silently crying for help. And then suddenly, it's too late. But things don't have to remain this way. Your body has a way of signaling you long before catastrophe strikes. It starts with whispers, escalates to louder messages, and finally shouts. The secret to survival and prevention lies in knowing how to listen. Let's examine the earliest warning signs of blocked arteries. These are real research-backed symptoms I've observed in thousands of patients over the years. Unfortunately, they are often disregarded or misunderstood until the damage has been done. We'll begin with a crucial red flag: chest discomfort. Don't assume this always presents as the dramatic Hollywood clutching of the chest. No. For many individuals, it resembles more of a pressure sensation. It may feel like tightness, a dull ache, or a heavy squeezing that begins subtly, especially during exertion, climbing stairs, walking uphill, or experiencing stress. Sometimes it radiates to the left arm, jaw, neck, or upper back. When this occurs, it's not random. Your heart shares nerve pathways with these areas, meaning what feels like shoulder pain could truly be a cry from your heart muscle, struggling for oxygen. We refer to this as angina. It means your heart isn't receiving the blood flow it needs, often due to narrowed coronary arteries. These arteries supply your heart. When they become partly blocked by fatty deposits, plaques, the oxygen supply fails to meet the demand during physical or emotional stress. This is when pain emerges. The issue? Many people dismiss it, thinking it's indigestion or muscle soreness. But every angina episode is your heart's way of warning you, not subtly, but urgently, that its oxygen supply is being restricted. Each such episode elevates your risk of a heart attack. Another concerning symptom is unexplained shortness of breath. If you find yourself breathless doing activities that were once easy, climbing stairs, walking across a parking lot, or even speaking while getting dressed, you must take this seriously. This isn't merely being out of shape, it indicates your heart's ineffective pumping. When arteries are blocked, your heart struggles to deliver enough oxygen-rich blood to your muscles. Your lungs work harder to compensate, causing you to breathe faster and deeper, yet you still feel suffocated. Notably, I frequently see this symptom in women. They may not experience the typical chest pain that men do. Instead, they report fatigue, breathlessness, or sudden cold sweats. Often, they delay seeking help because they don't recognize it as a heart issue. But if your breathing changes without a clear reason, this is a critical distress signal. Missing it can be detrimental. Now let's discuss something unexpected: dizziness, lightheadedness, or sudden nausea. When the arteries leading to the brain or heart narrow, blood pressure may drop or fluctuate unexpectedly. Your brain, reliant on a steady oxygen supply, reacts rapidly to this instability. You might feel as if the room is spinning, need to grab something for support, or feel faint. Some may experience nausea during exertion. These are signs of insufficient blood flow to your brain and gastrointestinal system, often precursors to more severe problems. I take cold sweating very seriously, especially if accompanied by fatigue or sudden anxiety. This isn't about sweating during exercise or hot weather. It refers to cold, clammy skin, a sensation that feels wrong. Your body releases stress hormones like adrenaline when sensing a crisis. If your heart is struggling due to blocked arteries, that is indeed a crisis. Cold sweats indicate your body is trying to respond to something dangerous beneath the surface, especially when paired with unexplained fatigue, not just tiredness, but profound exhaustion that sleep cannot remedy. Your heart is a muscle, and without sufficient fuel, it weakens, leading to full-body fatigue that makes daily tasks feel insurmountable. If you felt this overwhelming tiredness, you understand. Now let's address a symptom that can perplex even the most experienced doctors: pain radiating beyond the chest. This may feel like a muscle strain in your back, a pinched nerve in your arm, or soreness in your jaw after eating. However, these pains, especially when they appear during exertion and improve with rest, are often heart-related. The nerves transmitting pain from the heart overlap with those in your neck, jaw, back, shoulders, and arms. Thus, heart-related pain can manifest in unexpected areas. The most dangerous error is seeking relief from a chiropractor for upper back pain or a dentist for jaw discomfort when the true cause is heart-related. I've seen patients delay treatment for weeks thinking it was merely nerve pain, only to arrive at the ER with a major heart attack. Each of these symptoms is critical in its right. However, when they occur together, even subtly, you must take them seriously. Your arteries don't become blocked overnight. This process spans years, even decades. Although plaque buildup may be silent, its consequences are not. The human body is an extraordinary communicator. It's just that we've stopped listening or dismissed these symptoms as just aging. Every patient I've assisted who recognized their symptoms early had the opportunity to make life-saving changes, whether that involved medication, lifestyle changes, procedures, or all of these. Early detection is our most powerful ally. In Part 2, we will delve into more vital warning signs indicating that your arteries are in distress, including leg cramping, changes in your feet, and an unexpected early sign in men that may occur years before any cardiac symptoms arise. But for now, hold this thought. If your body whispers, listen. If it speaks, take action. And if it screams, act fast. It may be your only warning. Many believe blocked arteries primarily affect the heart. If you're not experiencing chest pain, they assume you're fine. What is often overlooked is the interconnectedness of your circulatory system. As arteries begin to clog, the effects can manifest in various body areas, often far removed from the chest. One early and revealing symptom many over 50 experience, but fail to connect to their heart, is leg pain while walking. Imagine this scenario. You start walking, and after a few blocks your calves ache. It might feel like a cramp or burning sensation. So you pause and rest, and the pain subsides. When you walk again, the pain returns. This isn't a muscle issue or bad footwear. It's a signal from your legs crying out for oxygen, known as intermittent claudication, a hallmark sign of peripheral artery disease, or PAD. PAD occurs when arteries supplying blood to your legs narrow due to plaque accumulation. When at rest, there might be sufficient blood flow. However, when you walk, your muscles need more oxygen than the narrowed arteries can provide, leading to pain from oxygen deprivation. I regard this symptom seriously because PAD rarely occurs in isolation. If blockages exist in your legs, they likely exist elsewhere, particularly in your heart or brain. If untreated, PAD not only affects mobility, but also increases the risk of heart attack, stroke, and, in severe cases, limb amputation. Yes, amputation. I've witnessed it. That's why we must act swiftly. If you're experiencing leg pain while walking that subsides with rest, seek a vascular evaluation, not just a foot massage. Next, let's consider non-healing sores and skin changes on your legs and feet. Have you spotted a minor wound on your foot that refuses to heal? Perhaps the skin's appearance on your legs has changed, appearing shiny, or a patch feels cooler to the touch. Do your feet display unusual coldness even under blankets? These alterations aren't random. They signal severely compromised blood flow to your lower extremities. Healthy tissue requires oxygen and nutrients for repair. When blood flow drops beneath certain levels, even minor injuries may not heal effectively. They linger and can become infected, leading to changes in skin color, pale, bluish, even reddish or blotchy. Some may also notice leg or toe hair loss because follicles lack the resources to sustain growth. These signs aren't cosmetic. They are vascular. Ignoring them only amplifies the potential for irreversible damage. A particularly critical sign I often ask my older male patients about, which they rarely connect to vascular health, is erectile dysfunction. It's not due to stress or relationship issues, nor from hormonal imbalances. Often, it results from insufficient blood flow. The arteries supplying blood to the penis are smaller than those feeding the heart, meaning they're typically the first to feel the effects of plaque buildup. Thus, for many men, ED can serve as an early indicator of systemic atherosclerosis, sometimes surfacing years before serious cardiac symptoms. If you're a man over 40 experiencing changes in sexual function without clear explanations, this isn't merely an embarrassing issue, it warrants discussion with your doctor. It could quite literally save your life. When I encounter new or worsening erectile dysfunction, my next move is invariably a cardiac risk assessment. It's that significant. Something commonly misunderstood, especially in older adults, is a transient ischemic attack, TIA. Often referred to as mini-strokes, they are anything but minor. A TIA entails temporary blood flow blockage to the brain, presenting symptoms similar to a stroke: numbness or weakness on one side of the body, speech difficulties, blurred vision, sudden confusion, dizziness, or even temporary paralysis. The key difference lies in the symptoms: resolution. They go away, sometimes within minutes, sometimes hours. This temporary nature leads many to disregard them, which is the gravest mistake you can make. A TIA is a significant red flag indicating that somewhere in your vascular system, predominantly in the carotid arteries in your neck, plaque accumulation is escalating. It may not have caused lasting damage yet, but it's only a matter of time before it does. 1/3 of individuals who experience a TIA will eventually suffer a full-blown stroke, often within 48 hours. That's why anyone displaying stroke signs, even if they resolve, must treat this seriously as a medical emergency. Seek immediate medical evaluation and imaging. TIAs serve as warnings, and we should consider ourselves fortunate when our bodies give us such signals. Now I'd like to highlight acute limb ischemia, one of the most critical medical emergencies linked to blocked arteries. Although rare when it occurs, it demands prompt action. Acute limb ischemia involves sudden and severe loss of blood flow to a limb, typically due to a fully blocked artery. This results in intense pain, numbness, and rapid tissue deterioration. To identify it, we monitor the 6 petaseconds: pain, pallor, pulselessness, paresthesias, paralysis, and poikilothermia, coldness in the limb. If you or someone experiences sudden severe limb pain, particularly accompanied by a cold or pale extremity without a pulse, call emergency services immediately. This isn't a wait-and-see situation for a doctor's appointment. Without swift intervention, often surgical tissue may die within hours, potentially requiring amputation. I've witnessed this happen to individuals who delayed, unaware of the urgency. Thus far, we've covered numerous symptoms, from subtle indicators to severe emergencies, from chest discomfort to limb-threatening concerns, and silent transient ischemic attacks to changes in sexual health. Yet, they all connect to one underlying issue: arteries gradually becoming choked with plaque. Not everyone will experience all these symptoms, but many will encounter one or two, often dismissing them. This is tragic because this disease is largely preventable. Early detection makes it treatable. Blocked arteries don't just endanger your heart, but also affect your brain, kidneys, legs, sexual function, and overall quality of life. It all stems from the same disease, atherosclerosis, presenting differently depending on where the blockage occurs. Therefore, recognizing these early signs is imperative. Remember, your arteries don't clog overnight. This process unfolds over the years due to lifestyle, genetics, inflammation, and negligence. However, the consequences can strike suddenly: a heart attack, a stroke that robs you of speech, or an injury resulting in amputation. But this doesn't have to be your fate. When I see a patient displaying early symptoms, we respond. We conduct tests, perform imaging, and make necessary changes. Early detection transforms lives and can save them. So if you find yourself experiencing any combination of these symptoms, don't hesitate or downplay them. Consult your doctor. Request a cardiovascular evaluation. Be specific. Inquire about your heart, carotids, and leg circulation. Demand answers. Your future might hang in the balance. If you feel fine, that can be the most dangerous situation of all. Many remain oblivious until a significant event occurs. So if you're over 45, particularly with high blood pressure, diabetes, smoking habits, or a family history of heart disease, please get screened. Even without symptoms, the best outcome isn't enduring a heart attack, it's avoiding one entirely. Most don't realize until it's too late that arterial disease won't wait for your next appointment, perfect timing, or for you to be ready to address it. By the time you notice blocked arteries impacting your chest, legs, breathing, or mind, the process is already in motion. Your body tirelessly waves red flags before permanent damage occurs. Previously, we discussed angina, breathlessness, dizziness, and leg pain. But what about symptoms emerging in unforeseen ways? Let's revisit your feet and legs, as signs here can be astonishing. When open sores develop on your legs, feet, or toes without healing for weeks, this reflects more than mere circulation issues. It indicates that tissue isn't receiving enough oxygen for renewal. Without oxygen, tissue begins to die. These non-healing ulcers often signal advanced peripheral artery disease. I've seen patients ignore small wounds, dismissing them as blisters, only to seek help when deep infections take hold. Tragically, some have lost toes or entire limbs due to severe arterial blockages that no antibiotics could remedy. Next, we'll explore something even graver: the color and temperature of your limbs. Have you observed that one foot feels colder than the other? Or that your toes seem pale or bluish, even in warm conditions? These subtle signs might be your first indicators that blood isn't flowing adequately. Healthy arteries deliver warm, oxygen-rich blood, ensuring even skin tone and temperature stability. Restricted blood flow leads to pale, shiny, or darkened skin in advanced cases. I routinely inquire about hair loss on the legs in older adults. This isn't purely cosmetic. Hair follicles are sensitive to circulation, and when arteries narrow, those follicles cease functioning. If you've noticed hair disappearance on your lower legs or toes over the years, don't disregard this as normal aging. It often signifies long-term oxygen deprivation. Your body is adapting to a problem that should have never gone unnoticed. Another symptom might be unexpected: vision changes or blurriness. Blockages in arteries don't merely affect the heart or legs, they can impact brain function, including your vision. Plaque accumulation in the carotid arteries, major vessels supplying blood to the brain, can quietly cause significant issues. You may experience sudden blurred vision in one eye or partial loss of your visual field. Some describe it as a curtain being drawn over part of their vision. Often, this may be a transient ischemic event like a TIA, where blood flow is temporarily interrupted. It resolves, so people tend to overlook it. But the underlying cause, arterial blockage, won't disappear without treatment. When someone reports sudden, unexplained vision issues that resolved, I don't hesitate to order carotid imaging. The next episode may not resolve, resulting in permanent blindness or a stroke. Lastly, let's address an important sign common in men but rarely discussed: erectile dysfunction. While often linked to stress or aging, the reality is that the blood vessels supplying the penis are among the smallest in the body. Consequently, these small vessels are often the first impacted by blockage. When a man in his 40s or 50s experiences ED without an identified psychological cause, I investigate deeply. In numerous cases, it indicates a cardiovascular concern that can surface years before significant heart issues arise. View erectile dysfunction as an early warning system for systemic arterial disease. Research shows that men with ED are substantially more likely to have heart attacks, strokes, or PAD within 5 to 10 years after the initial symptoms. Addressing it early, not just with pills, but through a comprehensive vascular evaluation, can genuinely save a life. Let's also touch on a more subtle yet dangerous sign: extreme fatigue. This isn't just being tired from a challenging week. I refer to an all-encompassing exhaustion that infiltrates your bones and lingers, regardless of how much sleep you secure. You carry a heavy weight. Tasks as simple as going upstairs leave you breathless. Basic chores require sitting breaks. This symptom often goes underestimated in chronic heart and vascular disease. When your heart isn't receiving adequate oxygen-rich blood due to blocked arteries, it works harder continually. Ultimately, this extra strain accumulates. Your muscles suffer from oxygen deprivation, your cognitive function declines, and breathing becomes labored. Still, because there's no acute pain or dramatic incident, you attribute this to age, stress, or poor sleep. In many scenarios, however, it signals a quietly failing circulatory system. Next is a symptom people notice but struggle to articulate: cold sweats or unexplained perspiration. This is your sympathetic nervous system reacting to cardiovascular distress. If your heart struggles to pump efficiently, or if oxygen delivery drops dangerously, your body enters survival mode, constricting blood vessels, increasing heart rate, and activating sweat glands. Cold, clammy skin isn't random. It's a significant medical signal. Finally, we discuss a critical and ominous warning: sudden numbness, weakness, or paralysis affecting one side of the body. This typically signals a stroke caused by arterial blockage in the brain. It can strike unexpectedly. One moment everything feels normal. The next, your speech slurs, your face droops, or you're unable to move your arm. Every passing minute in this situation counts. If you or someone nearby experiences these symptoms, act without delay. Call emergency services. Don't hesitate. Don't lie down. Don't wait for it to pass. A stroke occurs when brain cells die due to insufficient oxygen. The longer a blockage remains untreated, the more brain cells are lost, and the consequences are often permanent. However, many strokes are preventable. They don't merely occur spontaneously. They typically result from untreated, often unrecognized arterial blockages built over the years. Both vigilance to early warning signs we discussed today and timely action can dramatically reduce your risk. So, what steps should you take if any of these symptoms resonate with you? Begin by scheduling an appointment with your primary care physician. Request a cardiovascular risk assessment. Be direct and specific. Convey, "I've noticed leg pain while walking," or "I've experienced chest tightness with exertion," or "I'm worried about arterial disease." Push for essential screening tests: blood pressure, cholesterol, blood sugar, and an ankle brachial index for PAD evaluation. If appropriate, imaging tests like carotid ultrasounds or coronary calcium scans can provide deeper insights. And please, avoid self-diagnosis. These symptoms require professional assessment. They can overlap with other conditions, and only a trained medical professional can accurately identify the underlying cause. Here's the hopeful news. Arterial disease isn't a verdict of doom. It's a call to action. With lifestyle changes, proper medications, and in some cases, procedures like angioplasty or bypass surgery, those with significant blockages can lead full, healthy lives. Timing is essential, and earlier intervention equates to better outcomes. If you've stayed with me thus far, I sincerely thank you. Not just for watching, but for taking your health seriously. Many ignore these signs until it's too late. Yet, you've made the choice to be informed and aware. This decision, right now, may save your life or the life of a loved one. Don't delay, listen to your body, speak up, get checked. Blocked arteries offer no second chances.